Good day and welcome back to the second day of the ADA State of the Science Virtual Conference. We're so pleased you're here. I'm Kurt Johnson. I'm the co-principal investigator on the ADA Knowledge Translation Center, and I'm standing in for Dr. Mark Harness, who's the principal investigator who could not be with us today. I'd also like to acknowledge Kim Kanan, Linnea Johnson, and Fiona Dolezal, who are part of our team to make this all work with Zoom. The ADA National Network is made up of 10 regional centers, plus the Knowledge Translation Center here at the University of Washington. And anyone who needs technical assistance on the ADA can either phone or email, and one of the regional centers will respond to the request. You can also find this information on our website. We also are setting the 30th anniversary of the network this year. The ADA National Network is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research within the Administration on Community Living, and we'd like to acknowledge their support for our work and for this conference. Now let me go over some issues around Zoom. Many of you are familiar with it. First, you should see the slides on the left and the presenter and the ASL interpreter on the right. You can use your mouth to click and resize the video and the PowerPoint. We'll use the chat and question and answer that are located at the bottom of your screen. I'll tell you more in a second. Audio settings are on the left bottom of your screen, and the advanced view options are on the top middle of the screen. Next slide. Next slide. Well, we're not getting slides advanced, so I'll just talk. There we go. You can listen with your phone. If you have trouble with computer audio, select audio settings, choose to switch to phone, and follow the directions and dial the number in to log in. On next slide, you'll have a chance to ask questions. Submit the questions in the Q&A, and you'll have an option to submit it anonymously. Don't submit questions in chat. We won't be monitoring it for questions. If you're listening on the phone and are not connecting, email your question to adakt@uw.edu. We will have real-time, and you can upvote your questions. If you see a question that you like, you can update it by clicking thumbs up icon. And upvoted questions will rise to the top and be more likely to be asked. We also, if you have needed technical assistance during the webinar, send a message in the chat area or email adakt@uw.edu. We will have real-time captioning called CART, which is on the next slide. And next slide, we'll have ASL interpreters with us today. So we're 2 slides behind now. To ensure, I think we're readjusting the PowerPoint here. So I'll just keep talking. To ensure the equivalent visual access, presenters will describe any visual content on their slides. In addition, presenters may provide a visual description of themselves. So example, I might say, my name's Kurt Johnson. I'm a white man in my late 60s, almost 70s, with long red hair that you can't see because I tied it back today, and blue eyes, and I'm wearing a shirt. It's an increasingly common practice in the disability studies circles, and it may be new to some of you and or not to others. Now we're ready to transition to the keynote. We still don't have slides, guys. How do you want to proceed?
Just give me 1 second, folks. I'm really sorry.
Okay.
How's that?
I don't see a slide.
And now?
I see us that you've said that you're, I see that you said you're starting to share a screen share, but were there no slides yet?
Hey, Kurt and Kim. This is
Yeah.
Mark.
Hi, Mark.
I believe Sachin doesn't have a PowerPoint, so we'll just be speaking. So we
Cool.
could problem solve while he's speaking.
Okay.
Excellent. Well, with that, let's begin the day. Today's theme is community development and planning. And first, we'll hear from our keynote speaker, Sachin Pavithran, with UX Access Board. He'll present for about 30 minutes. After that, we'll have a short break, and then we'll begin 5 research presentations covering a variety of topics related to the community development and planning. We won't take questions during the 20 minutes, during the presentations, but we'll have 20 minutes after the presentations to ask questions, and then we'll take another short break. After the break, we'll have our closing speaker, Victor Pineda, who will summarize what we've heard today and where to go from here. So with that, I'd like to welcome Sachin from the US Access Board to kick it off for us. Sachin?
Thank you, and good afternoon or good morning, depending upon where you are. My name is Sachin Pavithran. My pronouns are he, him, his. Image description, I am a dark-skinned Southeast Asian descent person. I'm wearing a black suit, a gray shirt with a black tie. I have a virtual background with a US Access Board logo behind me. With that, first of all, I want to thank the ADA National Network for inviting me to be part of this event today. I've been part of the US Access Board for a few months now as the executive director, and it's an honor to be part of this event today. In behalf of my colleagues at the Access Board, I want to extend the appreciation of all the work that the ADA National Network and the regional offices are doing to extend accessibility and promote accessibility within the region that you're working in. It is an effort that we all need to be joined together to do, and we appreciate the hard work each and every one of you are doing to promote accessibility. The work that you do promotes the guidelines and the standards that we put forward to really make that a reality in the communities that all you live in. So thank you very much for your hard work, and also thank you for putting on this event, which is important to have some conversation in regards to what the future of accessibility looks like. To start off, I want to give a little background about myself. I was born in India. I'm a blind individual, born in India, grew up in Dubai, United Arab Emirates. Before migrating to the US, I had no exposure to what it means when it comes to accessibility. I was very limited what I came across when it comes to accessibility. Even through my education, K through 12, I had no access that we find here in the US. My K through 12 was accomplished because my mother took the time and effort to read all the textbooks for me. Accessible information was not available for me throughout my entire K through 12 period. So accessibility was a new concept after I migrated to the US to start my college and to enter university here in the US. That was my first exposure to what accessible design could look like. What is access? What someone like myself who's blind could do to be successful. Having that exposure, sudden exposure to getting accessible information, getting access to equipment that I could use as a blind person in a university setting as a student was a huge change for someone like myself who had zero exposure to anything what equal access should look like. So I was very excited to see the different things that I could do independently when access was provided. Even just the basic things that, having my textbooks available in an accessible format that I didn't have to rely on anyone else. Like I said, in my K through 12, almost my entire education was done because my mother was able to help me read my textbooks to me. So to do that and to have access available to me opened doors that I did not have options before. It gave me opportunities that I never thought I would have. But also, while I was exploring all these new opportunities I was getting, I realized there's more to be done. And the more I started realizing there are things that I needed more access to, the more conversations I was having with my peers who are blind or who are involved in disability rights, I started seeing the gaps. I started seeing what the potential of access could look like for everyone in the disability community. So that is where I got into the disability rights movement, to be an advocate for equal access and pushing accessibility, so we can really have an equal playing field. So full community inclusion is something I started pushing in my early years in my career. In order to do that, I realized the only way you can make something happen is having bold statements, putting out there, making bold moves that really challenges the norm. You can't just expect changes to happen by just asking for the very basic needs. You need to make those bold asks to really get what the end goal needs to be. It is scary to make those bold asks. Sometimes you are looked at as being unreasonable. Sometimes you are thought, people wonder whether you understand what it takes to do those different areas. But I also know what it means to me personally, what I am missing in my life without having equal access. So in order for me to be fully included within the community I live in and the environment I work in, I need to have the access that everyone else has. And the only way to do that is keep pushing for those bold asks that I was requesting, or which I was advocating for. So that's a little background about myself, where someone who came from no exposure to accessibility, no exposure to what access could look like, and how my perspective changed after coming to the US, and what I could do as being an advocate. I worked in the higher education space for 20 years, pushing for accessibility within university sectors, but also pushing for accessibility within communities around the country and internationally, and been very involved in advocating for equal access. I was fortunate to be appointed by President Obama in 2012 to the US Access Board as a public member, and I served in that capacity for 8 years. And in last fall, last December, I accepted an offer to be the executive director of the US Access Board, which I currently serve as in that position right now. So I've been in my current role as the executive director of the US Access Board for a little over 3 months now. And it's been a great ride, and I'm learning a lot, but I also know there's a lot of work yet to be done. I want to give you a background about what the US Access Board is and what we do in this federal agency. So the US Access Board is a small independent federal agency whose role is to push for accessibility designs. We set standards and guidelines that helps the environment we live in be accessible for all people with disabilities. So we do this by partnering with agencies, but also reaching out to folks in the community, like all of you who are researchers or city planners or people with disabilities, bringing all the different players to the table to have conversation, whether it's through training, whether it's through making working on regulations, setting guidelines, whatever it might be. Our role is to make sure we have quality guidelines and standards and design ideas out there so that accessibility is taken into consideration. So the federal agency, like I said, is a small federal agency, but we have a board that governs us. It's a board of 25 people, where 13 of the 13, let's see, there's 12 federal agencies that sit on the board, like Department of Justice, Department of Transportation, Education, Commerce, Health and Human Services, United States Postal Service. So all these 12 different agencies have a seat on the board, and the other 13 of the 25 are public members, like myself, who was appointed by Obama. I'm not a public member right now, but 13 of them are appointed by the president, and they come from various backgrounds with expertise in accessibility from different parts of the country. But one of the requirements is most of the majority of them need to be people with disabilities. So that is kind of the makeup of the agency. So we have 25 board members and we have a staff of about 30. So with this group is how we work together to make sure the accessibility conversation is happening within the federal government, but also in the community that we live in. I want to touch on some of the big areas that we are focusing on at the Access Board right now. With the new administration coming in, with the Biden administration coming in, there are certain changes that has happened. One of the changes happened on January 20th was the executive order that President Biden put in, where we have been given the authority to start getting into the business of rulemaking, because under the previous administration, the executive order that required 2-for-1 regulation, which stated that for any regulation that we introduced, we had to get rid of 2 existing regulations, which limited the work that we could do in any rulemaking that we had to do. So President Biden's coming in on first day, he rescinded that executive order, and now we are able to get back into the rulemaking business, which is one of the big focus areas for the U.S. Access Board. So let me touch on a few of the rulemakings that we are going to be involved in. Proact, public rights of way rule that has been in the back burner for a long time. I know when I accepted this position, one of the biggest push I got from the community, especially people with disabilities and those who work in accessibility, is when is Proact going to get done? So I want to assure you that Proact, the rulemaking on Proact is our highest priority. Proact is the rulemaking that will set guidelines and standards on your sidewalks, your shared paths, everything that you see within your community to have equal access for accessible travel, whether it's crossing signals, all those different areas within your communities to ensure accessibility is addressed for people with disabilities. So that is the highest priority right now for the Access Board as far as rulemaking is concerned. There are other regs that are also in existence that we are working on. So for example, the medical diagnostic equipment, that was a regulation that was passed right before the end of the Obama administration. There was one provision that was in there where setting the seat height for transfer. So there was a seat height provision for 17 to 19 inch that needed to be addressed. So that is something that we're working on addressing, because we are looking into doing some research to make sure we have the right data to support whatever we promote coming out of that. So that is one provision that's left in completing that reg. Everything else is out there as far as the regulation is concerned. So we will be working on that. That research had to be had to be stopped last year due to COVID, because in order to do the research that we were trying to do, we needed to measure wheelchair heights in person, and with COVID, that kind of limited what we could do. So that is another high priority. We have to get back into it. There are different rules that we are trying to work on, like the passenger vessels. There is the railway accessibility guidelines. There's been conversation about what happens with self-service transaction machines. So all these are different areas we're trying to focus on, but Proact is going to be our highest priority this year to make sure that gets done, because that is very important with the different conversations that's happening around the country right now. We all heard about the discussion happening around infrastructure. What is infrastructure going to look like in this country? We have a big role to play as folks in the accessibility space on what we can do to influence the future infrastructure of this country, because we want to make sure whatever is being done, that is done accessibly. So that is one thing we want to make sure that gets done. Other than rulemaking, the other pieces that we work on is technical assistance. We provide a lot of technical assistance, not just to federal agencies, but also to any entity or individual that's looking for guidance and direction when it comes to accessibility. Our TA hotline is always available for anyone who wants to reach out, and the information for how to reach us is on our website, which is access-board.gov. On top of technical assistance, we provide a lot of different trainings. We provide trainings in the space of Section 508, so anything to do with the 508 accessibility guidelines. We do built environment, any accessibility in the built environment. We also provide different trainings throughout the year in a virtual manner, and pre-COVID, we used to do a lot of these trainings in person. But all these trainings that we are providing virtually is archived and is available for anyone to view at any point. And it's available, and there's no charge to it. So please sign up for the different trainings that we have that we are offering. The other area we focus on is the enforcement of the Architectural Barriers Act. Now, the U.S. Access Board was founded to enforce the Architectural Barriers Act. That was the initial reason why we were put in place in 1973. We still do that role where we make sure federal buildings are accessible for all people with disabilities. There's a process that any of you can reach out to us and file a complaint if there's barriers when it comes to access to any federal spaces. So please do visit our website. We work with the agency that has jurisdiction over those spaces to make sure any complaints that comes forward is addressed, and accessibility is pushed forward. So those are the different focus areas that we have with the Access Board. With that said, there's still a lot of work to be done when it comes to access. There are things that the Access Board has been involved in over the last many decades. I said the Architectural Barriers Act was one of the areas that we were founded on. Then we start getting involved in the different areas like ICT, so information and communication technology, the transportation aspects, cities and towns, how to do accessible pathways, passenger vessels, all the different areas we start getting involved in. Now we are starting to get more involved in conversation around autonomous vehicle. We've been having webinars around what would autonomous vehicles look like in the future. There's been, people are unsure what that space is going to look like. What is our world going to look like when autonomous vehicle is in place and there's fleets, whether public transit or ride shares happening with autonomous vehicles. We all know if we don't push for it and if we don't make accessibility a priority right from the start, it does not happen. So at the Access Board, we are trying to engage in these spaces so that we can have those kind of bold statements, like I said earlier, to make sure we are part of the conversation. And I do have to say that this is not just the role of the Access Board, but it's all of our roles to make sure that we push for equal access and be bold about how we ask for what access should look like. Now, I know we have researchers in this in the audience. What can you do as researchers to push for good research? When you are creating your research question, how are you coming up with that research question? Who are you involving when you design your research question, when you design what you are trying to research? Are people with disabilities who are going to be the end user, who are going to be impacted, are they part of the conversation? How are we bringing people with disabilities to be part of the conversation of any research that's being done so that they are not just seeing the end product? It is critical as researchers to make sure people with disabilities are part of the conversation from the start, because if you want to make your research, if you want to make sure your research has good end results, people with disabilities need to be part of it. As someone who is very strong in the disability rights movement and really believes in advocacy, I really would like to push for researchers to really ask, are you doing everything you can to include people with disabilities? And the reason I bring that up is I've seen how some research gets done and the end result could have been significantly better if you have included people with disabilities from the start. The other group is, what are we doing when it comes to city planning? We talk about full community inclusions. So if you work in the city and towns, and if you're part of planning commission, if you're working on infrastructure within your communities, if you're working around the conversation of what city access, what access within your community should look like, how are people with disabilities involved in that conversation? Are you locating or are you involving people with disabilities to be part of that conversation? All that, it is critical, like I said earlier, to have people with disabilities be part of all these conversations, because you're missing the key component if they are not part of the conversation. Now, there are communities that do this phenomenally. They do it great when they involve people with disabilities, and the end results, you can see how the end results are in comparison to when people with disabilities are not included. But as a person with a disability myself, I know there's a role for me to play also. I can't always just wait for the researchers to come to me or the city planners to come to me. I know there's a role for me to play to advocate for myself as well. And for all those who are who have a disability within the audience here today, I challenge you to do the same, to be bold about what you're looking for, push for what you're looking for when it comes to access, without really pushing for it, without really asking out loud what you need, it's not going to happen. Accessibility is not something that just happens because we wish it would be there. Accessibility is something, it's an ongoing effort that we all need to come together to make it happen. Whether it's lawmakers, whether it's researchers, whether it's folks in academia, whether it's people with disabilities, we all need to play a role to make sure that we play our part to ensure the priority is always there. The conversation is now happening around the country about what the future of this country is going to look like when it comes to infrastructure and other important aspects of our community, healthcare, and all the different spaces. And we talk about smart cities, we talk about modernizing transportation, we talk about all these different areas. And there's a role that we all can play if we choose to. And the only way we can make it a reality and we can make it happen for all of us is if we take it upon ourselves to be bold, and we take it upon us to really ask for what should the future look like. With that said, I want to thank all of you for joining us, and also I want to thank all of you for the hard work that you do, because without your hard work, we wouldn't see the accomplishments that has happened over the last many decades. I know many of you have been involved in the space for a long time, and many of you have been mentors for us who are coming into the space. So I encourage and I thank and I show my appreciation for the hard work that has been done over the last many decades, but also look forward to the work that needs to be done. And I look forward to partnering with all of you that's out there. And also, please do reach out to the U.S. Access Board and hold us accountable for the work that we need to be doing as an agency, so that we can be, we can be the model that we've been founded upon. So with that said, I'm going to close my comments and open up for any questions that might be there in the audience.
Hey, Sachin, this is Linnea Johnson. I'm taking over for Kim to ask questions. We have a lot of really great ones, but the first big thing was everyone saying congratulations on your appointment as chair to the Access Board. So congratulations. And I had my question document open, and of course now I have lost it. So our first question is from Courtney Huck. She says, my name is Courtney. I'm a pro bono scholar in disability justice program at New York Lawyers for the Public Interest. People with disabilities continue to face accessibility issues on New York City ferries, and city law governing ferry accessibility does not address accessibility for people with hearing and visual disabilities. What is the current status of Federal Access Board guidelines on passenger vessels?
So thanks for the question. So before 2017, before the previous administration, we at the Access Board were working on the passenger vessels regulations, and we had our ANPRM out. We had comments that we were going through, and we had to come to a stop in the change in administration because of the executive order that was put out. With that said, the Access Board is going to pick the passenger vessel regulation back up, but it is going to be further down the road for us because of the priority shift that we have in regards to Proact Rule. The Proact Rule, from what we've heard from the community at large, is something that we at the Access Board feel like that needs to be addressed and completed sooner than later. So as soon as that is wrapped up in the near future, we plan to pick up the passenger vessel regulation rulemaking process.
Thanks, Sachin. And our next question is, you spoke a lot to researchers. How will current and emerging research inform the new guidelines and any other new standards or guiding documents? Have you noted any data gaps?
So I'm trying to understand the question. So it's guiding any research?
Yeah. So in the current and emerging research, sorry, I'm trying to read it while I go. How will current and emerging research inform the new guidelines and any other new standards or guiding documents? And in your research, have you found any data gaps?
All the different guidance we put out and the different standards we put out there, we try to base it on good research. So a good research is important for the work that we do. There is, as far as research gaps, there are, when in the space of ICT, in the space of anything to do with information communication technology, there's a lot of work to be done. I gave you an example of autonomous vehicles. There's a lot of conversation happening what accessibility should look like in the space of autonomous vehicles, but there's still a lot more research to be done. So research is going to guide the work that we do, no matter what the topic area might be. Is there gaps? Yeah, there are gaps in the different areas, especially in the IT space, that we need to address. Now, we got web accessibility and a few of those areas which we've been working on for a long time, pretty much under control what that should look like. Not saying we have figured out everything, but there are emerging technologies that is going to require research that needs to happen in order to push good guidance out there.
Thank you. You spoke a lot about PROAG, and you may have already touched on this, but folks are wondering if you can speak more about the timeline for PROAG rulemaking.
There's no way for me to give a deadline. So the best thing I can do is we are hoping that we can have a rule text out there that can start, because we need to have a rule text out there which will engage, after which is when we start what we call our regulatory assessment process, which is the process that assesses how much is this rule going to cost the country as a whole to implement. That portion is the portion that's going to take the longest time. Now, it's not something that we do internally. That is something that we have to contract out to assess that. Once that portion is done, the final rule should come out soon after. Now, the Access Board, our role is to put the rule out there as far as the PROAG is concerned, but we do not enforce PROAG. That is not our role. Department of Justice and Department of Transportation are the two agencies that enforce those, whatever the rule comes out. So it will be up to Department of Justice and Department of Transportation to enforce it. But as far as our portion, we're hoping in the next year, but it's hard to say, give an exact date. I wish I could, but it's just, there's no way for me to give an exact date to that.
We have all the hard questions for you, so people want answers. Our next question, are there any plans or hopes to consider updating the Section 508 regulations to include the Web Content Authoring Guidelines, WCAG version 2.1? This update came out after the 2016 refresh, which includes WCAG 2.0 by reference.
We have had conversations about what that should look like. Again, we don't have any timing on when that would be undertaken, but internally there's conversation happening about how to include WCAG 2.1.
And sorry, I'm getting some upvotes as we go. What are the plans to update the 2010 ADA standards for accessible design?
I feel like I don't have concrete answers to all of you. That is also another that is also another issue that we are wanting to undertake. With the way rulemaking works within our agency, being a small agency, when we undertake a big rule such as PROAG, the staff resources that's associated to work on a rule of that size really takes up the capacity what we have within the agency. That's one of the reasons why some of these big rules take the time it does. It's not because we don't have the desire to do multiple rules at the same time. Now, if it's different topic areas like working on ICT separate from those are different topic areas that we have different staff that can focus on it. But when we work on PROAG, which has the same, we need the same staff expertise that working on PROAG and the Architectural Barriers Act, it limits how much we can spread out. So with that said, I'm not trying to say it's not going to happen. It is something that's going to happen, but right now we made a decision to put our resources all into PROAG because that needs to come out, especially with the infrastructure conversation that's happening around the country.
Thank you. And some of these questions may already have been answered in different pieces, so I apologize if you're getting some.
Oh no, that's fine.
I have a question from Kelly Mack. This week, the 11th Circuit Appellate Court ruled that businesses are not required to provide accessible websites under the ADA. Can you comment on that ruling and the work the Access Board is doing to promote web accessibility?
So the Access Board, we issued our regs, the ICT rule in 2017. So our role was to put the guidelines out there, the Section 508. We do training and awareness about what web accessibility should look like. The enforcement part of that is not part of the Access Board. With that said, do we have a role to play to raise awareness? Yes. We just don't have the jurisdiction to enforce that. Now, what do I think about that ruling? If I was to take my Access Board hat off and put my disability rights hat on, I'm a little surprised that ruling came down the way it did. With the different lawsuits that's been going around the country when it comes to web accessibility, I was surprised the turn it took. So it shows there's still work to be done in raising awareness and advocating for the web accessibility component so that businesses can't get away with not providing accessible content. So there's work to be done, not just at the Access Board, but also all of you out there on what you can do to raise awareness and advocate for that.
Thank you. That's an important point. I have a question from Herschel Jackson. My question is regarding the automotive industry. During the last several years, as a deaf individual, I have found it very frustrating that automobiles are not fully accessible for deaf and hard of hearing drivers and/or passengers, especially during an emergency. How do we get the automotive industry to make their vehicles fully accessibly equipped for individuals who are deaf or hard of hearing?
Thanks for the question, and I'll be honest. You have stumped me with that question because I'm not sure exactly what the gaps are in the automotive industry when it comes to the deaf population is concerned. It's probably lack of my awareness, and it's something I would encourage you to email me so I can better inform myself. on that topic, but we do have experts that sit on our board who are experts in the space who might have a better answer to the. So I don't want to state something that that might be inaccurate.
We appreciate that. I told you I was going to ask you the hard questions that maybe there aren't answers for. So let's see if I've been looking for grant sources for ADA architectural improvements. I've been monitoring US grants websites for some time. Perhaps you can recommend some good sources. I would like to provide architectural design and construction services to public housing projects.
I'm not sure I'm aware of grant options that's available for that particular space. I know there's research grant options through our colleagues at Neidler for the different areas, but that's specifically on research that's happening within the accessibility space. Not exactly sure whether this would fit in that or not, but I'm sure our colleagues at Neidler who's attending this conference could answer that at some point if you want to direct that question to them at some point.
And we will be able to put some links in chat and send out things afterwards as well if people want to send these questions in later. Is or will access for development guidelines, let me rephrase this. Is or will access board will they develop guidelines to accessibility requirements as it relates to bike lane projects where on-street parking is located away from the curb, such as parking protected bike lanes?
It's one of the topic areas we are trying to address within Proact. So it is an area we are focusing. So yes.
And I think this is going to be our last question of the day, or for you of the day. Sorry, I just saw it move. Are there plans to update ADA regulations to explicitly include certified deaf interpreters?
Another question that I don't have an answer to. So, I will need to get back to who asked that question. If you want to email me at pavithran@access-board.gov, I do not have an answer to that.
Well, let's see if I have another better question for you. Again, we had another question related to city street parking, which you kind of covered. And I think that I'm gonna see if Kurt has any questions or he would like to bring.
Oh, this is Kurt. I don't have any questions, but Sachin, well, I have many questions, but I'm not going to ask you now. But Sachin, thank you so much. You did a fabulous job of covering both what the Access Board does and some of the issues related to ensuring that we have consumer participation or direction in research. And obviously you've generated a lot of questions, which I think allowed this to be more interactive than I might have expected. So thank you so much. Everyone, we're going to take a break now. It'll be 15 minutes and you'll see a countdown timer on the screen. And we'll see you again at 10:05. Thanks. Welcome back from the break, everyone. We're now going to move into our research presentations where we'll have 5 presentations related to community development and planning. Each presentation will be about 15 minutes. And after the final presentation, we'll have a 20-minute question and answer period. Please feel free to pose your questions as you go if you'd like in the question and answer feature. To start us out, Matthew Bro from the New England Center, ADA Center, will discuss the challenges that cities and towns have in implementing the ADA. So Matthew, go for it.
Hello, thank you and good morning, afternoon. My name is Matthew Bro and I've been a research consultant with the New England ADA Center for several years now. For those who cannot see me, I'm a white man just shy of 40 with brown hair with, I guess, just enough gray that it's starting to become noticeable. And I'm wearing a green shirt and glasses. So this presentation is entitled Identifying Challenges to Implementing ADA Survey Results. And I just wanted to quickly recognize my colleagues from the New England ADA Center who worked with me on this project, Oshie Harrison, Kathy Gips, Jason Angel, and Catherine Blakesley, and also Stacy Hart and our state affiliates who helped with data collection, and Neidler, the funder of this project. Next slide. So the New England ADA Center undertook this research project with several questions in mind. First being, how were cities and towns across New England faring at meeting their ADA Title II obligations? Which requirements were the most challenging to implement and why? Were there municipal characteristics predictive of compliance? And how could the ADA Center better tailor its resources to help municipalities meet their obligations? Next slide. So what we did was we fielded a survey with the help of our state affiliates to representatives from municipalities across the region. We did 2 rounds of data collection. Each was separated by about a year and a half. And in combined those 2 rounds, we got about 775 responses. We took this sample and we weighted it just to make sure that the sample was correcting for over and under representativeness of municipalities of different population sizes and from the different states. We also took the responses from these from the survey and linked them to characteristics from the 2018 5-year American Community Survey. And then we did our analyses. We ran on a number of different ways, looking at the region as a whole, by state, by population size, the population of the municipality, and by the number of municipal employees, which is an important factor because the Title II obligations differ depending on how large of an employer the municipality is. Next slide. So the questions asked about compliance with the 5 administrative requirements under Title II, namely whether they had an ADA coordinator, a notification procedure, a complaint procedure, had performed a self-evaluation, or had developed a transition plan. Respondents were also asked follow-up questions if they indicated they were not, if they had not completed a requirement, which asked them what was the reasons for that presented challenges for them to complete them. In addition to these administrative requirements, the survey also asked about accessibility of services, programs, and activities, such as accessible polling places, emergency shelters, and whether or not the municipal website was accessible. And each of these responses were linked to statistics about the municipality's aging population, socioeconomic status, their disability rate, and a potential tax base, which we kind of use the home value as a proxy for. In addition, municipalities were also assigned to an intervention which occurred between the 2 rounds of collection, which I will discuss next. Next slide. Yeah, so in between the 2 rounds, we conducted an intervention to try to get municipalities more engaged with the information to become more compliant. Namely, the ADA Center had an ADA action guide that we sent out to municipalities, and we really wanted them to become more engaged with that action guide. So We randomized groups, the municipalities, into 4 groups. The first just received the usual standard. They just received the informational email with the ADA action guide. Group 2 received that email, but also got statistical information about their area to kind of increase the salience of this topic and really try to bring them into wanting to engage on this in this area. Group 3, they got an invitation to a webinar, which would give a more intensive kind of assistance on this. And then group 4 received essentially both the statistical information and the webinar. And then in our analysis, we would then compare the compliance levels in round 2. Because there was a slightly shorter time horizon, we kind of wanted to look to see if municipalities had even taken some positive steps towards compliance. So we developed a point system sort of that gave 2 points for having completed a requirement and 1 point for being in process with a requirement. So that way, if someone had moved from having made no effort to in process, we could actually see that in the data. Next slide. So this slide shows a bar chart with the administrative compliance rate, the accessible service and programs and activities rate, and an overall compliance rate for the region and each state. Overall, only 5% of municipalities in New England were meeting all of their Title II obligations. About 1 in 5 were meeting the administrative requirements, and 1 in 7 were providing accessible services, programs, and activities. Those rates differed across the states, but all were very low. Connecticut seemed to be doing better than most of the others, and we think that this is related to they have a strong program for training ADA coordinators in their state, and we think that that thing likely has been paying off. Next slide. This chart shows the relative rankings of reasons why municipalities were not compliant, both for the region overall and by state. And what we see here is that the lack of personnel was a persistent problem across states, with a lack of knowledge as a commonly cited reason as well. In Massachusetts and Rhode Island, however, the lack of money was the more common cited reason. And we were actually surprised to see that money wasn't more cited, just because more anecdotally, people have always have kind of said things like, well, if we had more money, we would do this. But it did seem that, just one of in the written responses that, they just didn't know what they were supposed to do, seemed to be a big challenge. Next slide. Did the thing advance? Oh, I don't know if it's advancing. So the next slide basically gets to the, this chart shows the results from some of the regression we did using the characteristics about municipalities on predicting compliance. Basically, the center axis of each graph kind of represents no relationship. So the closer the point is to the center line, the more likely it means that those characteristics really are not very predictive of compliance. And what we see here is that characteristics like the percentage of the population in the municipality that were age 65 and over, along with the median household income and the median home value, were associated with slightly higher compliance for the administrative requirements. But much of that association went away once we got to the multiple regression models. Also, in the simple regression, disability rates were negatively associated with compliance, but after controlling for other characteristics, namely the socioeconomic status of the municipality, that association flipped. So overall, municipal characteristics, though, were not very predictive and explaining only a small portion of the variance in compliance. Next slide. This chart shows similar results from our intervention. And disappointingly, our intervention did not seem to produce really any noticeable change in compliance. The effects were both small and statistically insignificant. Next slide. So all of these findings and other presentations as well, these are being made available on a dynamic web tool that we created that allows users to create customized charts and tables based on sort of the geography and municipal population size. We're getting ready to, I think we've got it more or less going right now. We've been in beta testing for it for a while, but it's trying to make sure that it is fully accessible. So if you want to learn more or want to find more specific breakdowns, you can do that with this tool. Next slide. So our main takeaways were, first and foremost, that a large percentage of municipalities are not meeting their obligations under Title II. Basically, known state-specific actions appear to be helping municipalities gain compliance in those states that tended to do better, namely in Connecticut with their ADA training, ADA coordinator training program, and in Massachusetts, which has started a grant program to help municipalities both achieve their accessibility obligations in addition to some of their administrative obligations. But largely, municipal characteristics were not predictive. Essentially, having a large proportion of your population likely to need their local government, their governments to be sort of on top of their ADA obligations just didn't seem to be a driver for compliance. And it doesn't appear that making the communities more aware of that fact encouraged them to take steps towards compliance. Largely, it's that many efforts to further engage municipalities with the tools they need went ignored. So next slide. So kind of where did we go from here? In the study, we identified that the ADA centers need stronger ties with the municipalities before they can really effectuate change. Essentially, sending out a newsletter just wasn't going to be sufficient to get people engaged with the information and have them do what they're supposed to be doing. So those who may not be in a position to move things forward are often not in the same networks. Namely, I think that there's a kind of siloing that occurs between policy of certain types. And when you get to at the municipal stage, a lot of municipal policy is done and discussed through organizations like the state municipal associations. And so I think trying to get the ADA centers more involved in these other organizations that may not be disability specific or disability targeting, they are as a way to sort of get in and start engaging these municipalities and the representatives from those municipalities on these topics. But largely closing the knowledge gap is still the primary aim for this. As many of our surveys told us, they just didn't know what they had to do. And so sort of continuing with that effort of trying to really improve knowledge is where we're going to still be going. So next slide. And this just has some of my contact information, and I'll happily take your questions during the Q&A.
Thank you so much, Matthew. That was great. And we'll look forward to some questions during the Q&A. This is just a reminder to you that if you have questions about implementation of ADA or how it relates to your rights or responsibilities under the law, you can call the ADA National Network at 1-800-949-4232. And you can also access that through the website, which is www.adata.org. Now we'll move on to a presentation from Rich Turnadore at the Great Plains ADA Center. Rich, you ready to go?
I am here, yes.
Okay.
Good morning, everyone. I appreciate the opportunity to be here. I want to be sure to give our acknowledgements to my colleagues, as well as the KT Center, ADA Network, ACL, and NIDLR. Let's go to the next slide, please. I can't see my slides on the screen, so there we are. Let's go to the next slide. Our study was called the Status of the Americans with Disabilities Act in Local Governments, Integrating Community Capital Resources and Advancing Sustainable Accessibility. very similar to what New England did in some ways, what the New England Center did. And I know Matthew and I are going to need to talk now that I've seen what they've been up to. Our study was, what did we want to know? We wanted to know how our local governments, not state, city and county governments, were applying the ADA regulations, in particular Title II, but also some related provisions. We wanted to understand a specific set of resources there. It was more of a practical matter, not theoretical. We used a specific set of public resources or community capitals to gauge where our communities were. We had 4 central objectives. That is, how can we improve delivery of our ADA center services? What's the impact of rural versus urban demographics in those local governments' endorsement and application of the ADA Title II regs? How can that responsiveness of that jurisdiction affect the livability of a community? And then finally, how would what we learn affect our ACTCP ADA coordinator program, our symposium offerings, and other webinars and targeted trainings? Next slide, please. We developed a needs assessment, I would call it. We developed a questionnaire and instrument that had 58 items, or 51 items altogether, 28 with 23 subcomponents that we actually distributed through each of the state's leagues of cities and associations of counties, as well as a risk management association that underwrites all of Nebraska's counties. We did a pre-advertising with them. We did some recruitment through them, and we used their listserv without access to the listserv, I might add, to distribute the promotion as well as follow-ups and the actual instrument. This gave us some credibility because the recipients or respondents knew who the email was coming from. They knew that there would be some assurance there's no enforcement going on with some of the sensitive questions we were asking. We had about 3,021 jurisdictions that we could have reached, and we ended up with about 13% of them responding, or 387, the majority of which, about 77%, were actually identified as rural, self-identified. Next slide, please. So we used a community development model, waiting for the next slide here there we are. We used a community development model from Flora, and Frey, and we took 7 community capitals or resources, if you will, which have to be integrated and looked at as a whole to measure these communities. And those resources would be natural, cultural, human, social, political, financial, and built. Now, the community capital framework measures the strengths of those, not the weaknesses or not the shortcomings of the community. And we triangulated those into themes. Next slide, please. So synergistically, we're looking at all of these 7 community capitals, and we're analyzing them in a way that, as an example, financial, cultural, human capital might be the inclusion and influence of the disability community in accessibility budget-driven strategies, policy strategies, support for ADA coordinators, the status of self-evaluations and transition plans. For built environment, which does include the web access, we would also look at adoption and enforcement of accessible design documents, including the building code and the 2010 ADA standards, et cetera, use of PROAG. And we looked at compliance of facilities under the built environment, in particular recreation, which speaks to livability, same as the web access. Next slide, please. I want to mention there are some handouts. The handouts include 2 matrices, and these matrices that we put together, the first one is number 9 in the handouts, and I'll get to that in just a moment. But what you're seeing on your screen here is a blank field because it's so complicated, we couldn't really make it accessible. Down the left-hand side are the community capitals. Across the top, we looked at possible examples to explain, let's say, built capital or human. And then what questions would we use to measure that exactly with the communities? Next slide, please. So we're going to take that blank screen you just saw, and we're going to explode it with some of the actual information just for built and human capital, and showing the examples we used to explain where we are, the status for built or human or financial capital, and then questions that would measure that in our instrument. Next slide, please. We also have in the handouts, it's slide number 9, and it's the J.A. Maxwell integrative approach to qualitative research, where we would ask, what do we want to know? Why do we want to know that? What kind of data will answer that? What are our analysis plans? What are the validity threats? What are the possible strategies for dealing with those threats? And then the rationale for those strategies. And we applied them to our 4 objectives in the beginning. That is, improving delivery of our services, impact of rural versus urban, ADA responsiveness of the community affecting livability, and then how the findings affect our educational offerings. Our findings are that the constructs for cultural, political, social, built, financial, and human capitals are underwhelming in the rural areas. As I mentioned, 78% identify as rural. So the majority of people that reported, just like in the New England Center, indicated an insufficient allocation or focus of financial and staff resources to prioritize the ADA. So it's almost like Maslow's hierarchy. We looked at again, Title III access to goods and services and Title II recreation, and found that livability was inconvenient for the rural communities. The top 3 ways our center could assist the jurisdictions were sidewalks, financial assistance, and Title II recreation. We also learned that 60% of ADA coordinators are housed in HR departments, human resources departments, which immediately gave us some, again, practical information that we're going to do a stronger, more robust outreach to the Society for Human Resource Management. Out of 40% of the respondents that had 50 or more employees, not just full-time, but employees, 63% of them have no ADA coordinator, where of course they would be required to have one. And 78% of the respondents were able to dedicate less than 20% of their time toward their ADA duties. Next slide, please. So there's a strong finding that, we're going to focus with SHRM as an example, and other agencies. Small rural jurisdictions under 5,000 reportedly were really underserved compared to those within 25 miles of the metropolitan centers. So as we gauged this, we had what we'd call remote rural, farther than 25 miles from a metropolitan center, rural within 25 miles, and then urban suburban. And we were able to tease apart those 4 demographic categories. About 78% of the jurisdictions responded they had used the ADA Center, and 78% had responded they were aware of the ADA Center. That leaves about 22% that we maybe hadn't reached, or we reached and there was a branding issue where we were partnering maybe with an outside agency or something like that. There might have been limitations. One of the weaknesses of the study is that we did use the listservs of the agencies, of the city leagues and the county associations, and therefore we're not able to control who received that. Their membership might have been the sheriff, it might have been the county clerk, it might have been a building official, an ADA coordinator. We couldn't control that. That also was a strength in the study, but it was also a limitation. We found that 57% of the jurisdictions, rural ones, still required building permits, but 52% of those didn't do pre-construction reviews. So therein again, speaking to our 10-year alliance with the International Code Council, which the ADA centers have spearheaded. In particular, our center was involved in bringing them forward about 10 years ago, and our alliance with them at symposium and at their conferences, in webinars, etc. We found an insignificant influence in the rural communities of the disability community in the rural governance. That is, 15% indicated they had no influence in the disability community, had no influence in governance, and 25% indicated just somewhat. So therein we can see some issues with political leadership in these rural communities and the need to strengthen our alliance with them through the leagues of cities and association of counties who distributed our questionnaire. Next slide, please. So now we have access. What can we learn? We reached 3,021 jurisdictions that we hadn't reached before through the leagues of municipalities and county association. That's a big deal. And we're using that. We've already met in the annual conference with the Missouri membership and reported these findings back to them, their own findings, their own reporting, and indicating what we learned from them. And that is right now in the works for Kansas. And we'll be meeting with the Kansas conference in their annual conferences. And then we're going to do that again within Nebraska and Iowa. So that's a big deal. We know now that we reached 22% of people who had previously indicated they hadn't heard from us, almost a Hawthorne effect, if you will. We can see that we need to do enhanced rural capacity outreach and education, in particular with our ADA coordinator program, which is going to be a great tool in those rural areas where communities that have more than 50 employees. We also can see the critical alliance with the International Code Council and how we're going to refocus that and the education that we're offering there. As an example, the Code Council has begun to offer ADA coordinator introduction to the building code, because we see that the building code is the default mechanism in a lot of these smaller communities for enforcement. Next slide, please. Our branding is an important issue. We feel that when we partner with, let's say, with a state agency or some other agency, and they're the host of educational program, that maybe we're not getting our name as the ADA Center up front and center as we need to. We also learned a great deal about webmasters. As an example, Nebraska has a webmaster for the entire state. And so when we talk about web access, we can see that we have a very strong need for education there within our jurisdictions, within the local governments. And we're going to do that through the Leagues of Cities and Association of Counties. We found grant funding, sidewalks, and education of elected officials in the qualitative answers were very strong, and a need there. Recreation, access to recreation in rural, and then, as I mentioned, distributing the data back to these jurisdictions is underway. Next slide, please. Finally, some of the limitations, as I mentioned, we didn't control who received and who responded to the instrument that we distributed, and that's good and bad. The other things that happened, another, I'd say, weakness of this study is that we altered a few items after the Kansas survey because we felt we weren't hitting our targets, and that made it difficult for an apple-to-apple final analysis through Qualtrics when we compared all 4 states. Regardless, we've separated that out. And during the 5-year study, of course, COVID hit. The university and our college underwent some significant changes. We had retirement of our dean and of our director of our center. One of our co-directors passed away, sadly. Our analyst needed to be replaced, and our thanks to our new analyst, Dr. Fisher. And so there were a lot of changes that occurred throughout this study that kept us on our toes as far as keeping this thing moving forward. We're very excited for what we've learned as a practical component of it and what we can do to move forward with what we've learned. So thank you, and I look forward to your questions. Next slide. I look forward to your questions as we wrap up all the presentations.
So thank you so much, Rich. I know your center's been through a lot over the last 5 years, and it's impressive that you were able to conduct and complete this research. Next, we're going to move to Yochai Eisenberg from the Great Lakes Center. Yochai is going to present on the ADA transition plans. Yochai?
Thanks, Kurt. I'm really appreciating these presentations. I don't know about everyone else, but I'm really enjoying the conversation so far. And I think these are great presentations, and hope my conversation can add to that now as well. So I'm Yochai Eisenberg, and I'm a white middle-aged male with short brown hair, wearing a blue button-down shirt and a black blazer. And as Kurt mentioned, I conduct research at the Great Lakes ADA Center with my colleagues listed here below as well. And today I'm going to tell you a tale of an elephant, an apple, and million-dollar lawsuits, and try to synthesize some of the strengths and limitations of current efforts to plan for pedestrians with disabilities. Do you want to hear the quick version? Okay, here goes. There's a big elephant in the room that is being ignored. Do you all see it? Take a minute. The elephant that's being ignored is the lack of barrier removal in the pedestrian infrastructure. It's strange that it's being ignored, really, because an elephant can be very costly. Communities that aren't dealing with the elephant are paying millions of dollars in required infrastructure changes and lawyer fees. Eek, I'd feel trampled if I was in that situation. But there are communities that are talking about the elephant and are taking on the enormous challenge that the elephant represents. We'll share some valuable lessons from these communities, such as not eating the apple all in one bite, which seems obvious, but is important to help communities keep in mind that they can be strategic and realistic in the face of the elephant. Let's go to the next slide, where we will start the feature film here. In a second, we'll be in the next slide. And I'll just say, well, that's being set up that to set the scene, the story will focus on pathways. These pathways include sidewalks, curb ramps, and crossings. And I'll just wait a second for this slide to come up. And it's great. So as I was saying, pathways for walking and wheeling are important for people to get to the places that they want to go and to be a part of the community. However, pathways that are broken or not built in the ways that are easy for people with disabilities to use make walking or wheeling difficult. People with disabilities describe how such barriers limit community mobility, participation, and as we heard yesterday, even access to employment. Next slide. The problem is that these barriers don't seem to be going away. Now, I say don't seem because it's not like this is a new problem or that nothing has been done about it. I show two images here of these types of problems. One is a corner with no curb cut, and one is a badly broken sidewalk. And I'll say that, there's no doubt that progress has been made. And there's much more infrastructure that is accessible than 30 years ago. But what seems clear is that the progress is not sufficient. This has been made apparent through numerous class action lawsuits, highlighting the enormity and widespread scale of the problem, including in Sacramento, Chicago, Seattle, and a very interesting case study in San Juan, Puerto Rico in 2020 that I encourage you to look up. Furthermore, in a study we conducted of 401 entities in the US, we found that among communities reporting barriers in the pedestrian environment, an average of 65% of curb ramps and 48% of sidewalks were not accessible. In other words, more than half have barriers. Next slide. As many of you know, under Title II of the Americans with Disabilities Act, local public agencies are required to develop barrier removal plans for pathways called ADA transition plans. However, in our systematic evaluation of plans, we found that only 13% of communities in the US have plans for pathways. And perhaps importantly, the quality of the plans was not strong. None of them met all the minimum criteria required. And what you could see is, pretty similar results between what we found and what Matthew shared earlier. Now, why does this matter? Well, plans that are low quality are not likely to be effective in making pathways more accessible and are more likely to end up sitting on a shelf. Next slide, please. After learning about the lack of ADA transition plans, we wanted to understand more about what goes into making a high quality plan, i.e., how communities are dealing with the elephant. We wanted to focus in on how these key ingredients of success and share them so that other communities do not have plans can learn what they need to do to be successful. We sought to learn from individuals who work in cities and towns and other local governments called ADA coordinators about how they have developed high quality plans. And we wanted to answer the question, what are the community, organizational, and interpersonal factors that support the development and implementation of high quality ADA transition plans for pathways? Next slide. So how did we do this study? We identified municipalities who developed high-quality ADA transition plans. We identified them through state departments of transportation and ADA Center technical assistance providers. We then recruited ADA coordinators and their team and conducted a 1-hour interview using a structured interview guide. Next slide. Once we conducted the interviews, we transcribed them and organized the findings from our interviews using a template that other researchers developed to study successful practices that organizations use when putting new services or interventions into practice. This template, called the Consolidated Framework for Implementation Research, or CFIR for short, helped us organize the successful practices of ADA coordinators into categories that are important for carrying out a plan effectively. In other words, what researchers like to call validated categories. Think about it like you had a really good stew at a friend's house, back when we used to go to other people's homes and eat their food. And you really want to know, you know that it's really good. And so you ask for the recipe and how they made it. We wanted not only the recipe, but the details for how communities with really good stews made their plan. And the CFIR gave us the categories of how to ask for that in terms of the spices, the time, the oven temperature, how long to mix the batter for, all in terms of ADA transition planning. Next slide, please. So what did we find after talking with these master chefs? Here are just some of the important findings we wanted to share and some excerpts from ADA coordinators that we interviewed. On the next couple of slides, there's going to be some of the headings that I mentioned in terms of validated categories, but I'm not going to really go into them for brevity's sake. So the first important finding we wanted to share was that organizational change is needed to build support and buy-in for the plan and implementation. Next slide. So what does organizational change mean? Here's an example quote. "It's not just a block on a checklist, right? That's not what the intent of the ADA is, in my opinion. It's a complete philosophy change in the way that we look at and treat other people. It's a sense of awareness that someone who might have a disability still has the same rights and accessibility to everything that we provide as a city." And another, "It's amazing how a 30-year-old law requires so much handholding and educating. But yeah, that is consistently being reinforced." So this isn't just about having a speaker with a disability for a one-day event, or even just hiring an IDEA coordinator. It was described as an overall change in how disability is understood and valued in the organization of the municipality, from the top, mayors and managers, to department heads, department staff, and down to, of course, citizens as well. And that is something that doesn't just happen once. It's something that requires ongoing reinforcement. Next slide. Next slide. Just waiting for the next slide to show up here real quick, but I can just go on that interviewees described how involvement of people with disabilities in planning was key, something that was said earlier in the keynote speech, right, and reinforced throughout this conference. But involvement needs to go beyond just posting plans on a website, which we see many examples of in ADA transition planning. And it needs to involve a committee where people with disabilities have important voices. Should I wait for the slide, or?
I'm going to stop sharing and come back on for just one quick minute.
Sure. Yep. I'll just, say while we're getting the technical parts of this going that, involvement in talking about public rights of way, takes a certain touch because the language of it is very technical, right? And those who are involved, engineers and architects, speak very technically. about the process and the development. And one of the things that we see in some of these plans and ADA coordinators who did really good work with their plans and engagement is that translation of this engineering language to citizens, most people like myself who don't have that engineering background. I'll go ahead and just read the quote since it's not much there on the slide, but this is an example of a successful involvement of people with disabilities. And they're instrumental in us developing the plan. We communicate to them what the plan is, and where they really get into the meat of the plan was how they're addressing our barriers in our transition plan and what we're prioritizing. In other words, the Disability Advisory Committee was valued and engaged in the process to arrive at the priorities that they felt were important. Another finding is that interviewees mentioned the importance of their own experience and training as being critical supports, something that Richard talked about just now in terms of the training that they provide, and we heard about the one in Connecticut too, that these are important supports for ADA coordinators to lead the way in developing successful plans. But the issue is that they come from often diverse backgrounds and training, as Richard mentioned, a lot of them from HR, engineers, architects, planners to lawyers. And it's rare that ADA coordinators have only one hat. They typically have another position, and ADA coordinator is another hat that they wear. So here, the example for the characteristics of ADA coordinators, the quote is, "I understand it. I grew up near Berkeley, so I know about the independent living movement." There we are, thanks. This coordinator had a long history and thorough understanding of the disability community. They were involved with the disability community locally, and through that were supported in their work to create a successful plan and successful engagement with the disability community. Next slide. Coordinators also discuss the importance of just getting started with the planning and barrier removal. Indeed, seeing the size of the elephant is scary, the hundreds of roads that potentially have barriers, but it's important to just start. Next slide. Our interviewee shares this advice: eat the elephant one bite at a time, take baby steps. Okay, what is the first thing you need to do? And then when you do that, find someone. For example, for me, it was, let's get this data collection started. Let's try an engineer. But for other communities that don't have that money, we've got to get this data collection. Let's find a partner with our schools or volunteer groups to make this happen. I think this quote speaks to the iterative nature of the ADA transition planning and what officials like to describe as a living document. You have to start somewhere, make some progress, learn from that progress, and keep moving forward with it as you're adding on to it. And importantly, for engagement, be transparent about that progress and what you're doing, when you're doing it, and when people can get involved. Next slide. Finally, and the last important finding that I'll share is that communities need to be both strategic and realistic. We all would like our communities to be fully accessible tomorrow. And while communities should have done more than they have by now, the lack of municipal funding is not something that is changing and actually likely to get worse due to the COVID-19 pandemic. Next slide. So here's a quote related to being strategic. My recommendation to any community, regardless of size, getting ready to take on an inventory, and to explain, an inventory is what you do to learn about the barriers in your community and involves going out and assessing or looking at aerial imagery. So what he's talking about is getting that started. It's not productive for them to take the approach that they're going to eat the apple all at one time. Taking it in manageable pieces is reasonable for everyone, right? And it goes back to the concept of good faith. Now, communities can't wait until they get sued because then guess what? It's not going to be manageable. So communities need to be strategic of what they're going to accomplish, and through that approach, make good faith progress so that all parties involved are feeling like progress is being made and communicated. Next slide. So what is the takeaway? First, I think communities that have not developed plans or with lower quality plans can learn these important lessons from the communities with high quality plans. In other words, there are good recipes and ways of cooking and dealing with the elephant that we've all been ignoring. Clearly, certain resources, networks, and voices can help support communities in creating higher quality plans. But I think tools are needed to make that easier for lower resources communities to get started and make progress. For example, crowdsourcing platforms for data collection and more detailed technical assistance with making the plan along the way. Creating a high quality plan means the whole organization needs to change. And this is a daunting but important effort. Organizational change is an investment that takes time and reinforcing, but is really needed for a high quality plan to be developed and implemented. We want to see that plan be implemented. Next slide. Our next steps to strengthen our findings are that we want other communities to learn from the successes that we identified. We plan to share our research findings in various forms, including on the internet and through case studies. The process that we used can also be an iterative process as well, to continue to gather and disseminate successful strategies online so that more and more communities can learn from each other and these examples can be shared. Our aim is for more communities to use these successful practices identified in the study to develop high quality ADA transition plans and ultimately more accessible communities. And that's all that I have for the presentation, and look forward to any questions or comments you might have.
Yohai, thank you so much. We really appreciate it. And sorry for the interruptions. Our next presentation is about emergency management, and we'll hear from Robin Gershon from the Pacific ADA Center.
Thank you. Thank you so much, Kurt, and thank you so much to my colleagues on this panel. I have really been enjoying these presentations, absolutely. Now, before I begin, I would just like to describe myself. I am a clinical professor at NYU. I'm a public health disaster researcher, and yes, this past year has been the busiest one I've ever had in my life, and I hope to never have another year like that. I am a white middle-aged female. I have brown hair and brown eyes, and I have a bright blue jacket on. Now, I'd like to first start by acknowledging my wonderful colleagues, most especially my long-term colleague, Louis Krause. He and I have been working on this issue of emergency preparedness and disaster planning for people with disabilities for several years now. And we have a few other of our more junior colleagues listed here, and we're very grateful to them and to NIDLR for the funding. On the next slide, why did we do this study on ADA roles and responsibility with respect to emergency management? What did we want to know here? We wanted to know what they were doing, what the barriers to their ability to influence not only their office, but other entities in ensuring ADA access with every aspect, the full paradigm of emergency management, which means mitigation, preparedness, response, and recovery, the full paradigm. And we, of course, wanted to identify strategies for improvement that would be suggested by the data. Now, one of the things that you might be asking yourself is, why is this important for us to know? If you're not in the world that I'm in, and I've been in this for 2 decades now, you may not realize what the trends are that are making this imperative that we address this issue. First of all, in an earlier study that Louis and I conducted, it was just published. If anyone would like a copy of that, we're happy to send that to you. But we found that the Office of Emergency Management, which is arguably the most important agency in charge of every aspect of emergency management. We found in that survey of FEMA Region 9 or Region 9 that they were not ready, they were not prepared, and they did not have the time or the resources to be responsible for ADA. But in addition to this issue about their being responsible for ADA, other very important and critical major converging trends are happening you may not be aware of. A perfect storm is forming. I mean, you may have some idea because of what happened this past year with COVID in terms of how unprepared we might be for major public health disasters. And of course, every major disaster becomes a public health disaster, but we have several things going against us. One is, of course, the incredible increased frequency and severity of disaster events. Most of these are climatological in nature, but even such things as, earthquakes and this natural disaster of a pandemic, these are also increasing. That's very well documented. The other major trend is that we have an increased number of people with disabilities. And of course, we have a huge population of older people that will be joining that category because a lot of them do have one or more disabilities. I don't know how many of you know, but 10,000 people a day turn 65 years old in this country. So that's something else we have to think about. And very importantly, in earlier studies that we conducted, we found that people with disabilities are half as likely as people without disabilities to have even the most rudimentary aspects of preparedness planning, even the most rudimentary things such as extra medications on hand, 3 days worth of water or food, things of that nature. So they are not prepared. If you think that they are, for the most part, they are not. And then the worst of it all, of course, is that people with disabilities have more than twice the risk of having a disabling injury related to the disaster and or death. And of course, they also are much less likely to receive benefits, and they are less likely to recover and less likely to return to pre-disaster status. So for all of these reasons, it's absolutely critical for us to know what is the relationship between ADA and the emergency management world. And not only, of course, is it an issue of disparities, health disparities, inequities for sure, it's also, of course, the law. It's against the law to discriminate in this way. On the next slide, please. Our methods were quite straightforward. This was basically quantitative study, just descriptive study, a first pass. It was conducted right before the pandemic. We had wonderful input from our key stakeholder, ADA coordinators. Some of you may know, Ali Everett, Lainey Davidson, and Kristen Darmody. We also had wonderful assistance from Marcy Roth, Erica Jones, and June Kales, who were absolutely essential every step of the way. Now, this confidential web-based survey using Qualtrics was focused on ADA coordinators from our Region 9, that's California, Nevada, Arizona, Hawaii, and the Pacific Islands. We used a multimodal recruitment. Basically, it was a passive recruitment. We had several major domains. Basically, it focused in on their own role, their responsibilities, their training, their level of influence, knowledge, and so forth. It was a short survey, only 36 items, took about 15 minutes. And after cleaning up data that was incomplete, we wound up with a final sample of 131. Next slide, please. So mainly the sample came from California, followed by Arizona. More than half, 56% were women, 35% had a disability, more than half were 50 years and older. 44%, and this gets to something, Yokai, I hope I'm pronouncing that correctly, Yokai, 44% worked full-time as an ADA coordinator. They had all kinds of other jobs, and they were coming out of all sorts of different agencies, the mayor's office, the city planner, the architect, the legal. They were all over the place, even a few from the Office of Emergency Management. So they had different titles, different roles, different jobs as an ADA coordinator. Now, one of the most critical findings, and I remember clearly when Lewis and I went over this, we had this one important question: what specific training or qualifications are needed for this incredibly important job? And a remarkable 26% said None. Next slide, please. When we asked in this next slide, the title is who is responsible? Who do you think is responsible for assuring access? Who do you think is responsible? And this was asked of the ADA coordinators. 45% said that Office of Emergency Management is responsible. Well, that's simply not the case because they told us that they were not responsible. 11% of our ADAC said first responders are responsible. It seems a very unlikely job for them. 9% said it's the ADA coordinator's responsibility, and 8% said no one. On the next slide, when we asked them, well, what about your capabilities? How capable, what about your capabilities for doing this job? 16% said they felt influential in their role in terms of emergency management. 22% said they felt knowledgeable about it. 36% said they felt that they had had adequate training. On the next slide, we asked them what limits your effectiveness? And many of them, this was a write-in question, many of them said lack of time, lack of awareness, lack of resources, lack of staff. Another colleague said that recently, and lack of competent staff. My own lack of knowledge and training, the lack of authority in my role as ADA. And of course, changes in administration, making it hard to develop relationships. On the next slide, we asked them, well, what would it increase your effectiveness? Many of them wrote in more training. Some said more support from other entities. Some said more involvement and collaboration with the Red Cross and the OEM. Said some more coordination with disability organizations, stronger work relationships, and more supportive work environments. On the next slide, in conclusion, it seems pretty clear, at least in this small sample in one region, that no one seems to be in charge for ensuring equity. Obviously, we have a lot of study limitations, including that it's not a representative sample, it was not a random sample, but it's a first pass, and it's a step upon which we can build upon. We definitely feel, and we have heard this from many of our colleagues, that there's tremendous underutilization of ADA coordinators, and I think we've seen it already here in today's talks. There's definitely an interest on their part in improvement and having a much greater role. They especially want to know more about ADA compliance with respect to emergency management, and that is highly admirable. Obviously, next steps would be a much more robust and rigorous study replicated in other regions. And importantly, next steps that are already happening, it gets to the issue about organizational culture and climate and change. And that is that they're taking matters into their own hands and they are forming networks. Of course, it is with a lot of support, especially from the Pacific ADA, and I'm sure it's happening in other parts of the country. They are forming peer-to-peer support, peer-to-peer mentoring. They're helping each other and supporting one another because there are unfortunately limited avenues for them to get this very kind of specialized training. And if you think that, oh, it's not such a big deal, how hard could it be? They can certainly learn what you need to do. Think about for a minute about Hurricane Sandy, which by the way, led to huge class action lawsuits, having problems with evacuation, having shelters ready, identifying where people may be sheltering in place, people without power, people needing food or supplies, their caregiver, all kinds of things. The emergency management world is complex. So we hope going forward that more people will advocate for a greater role for the ADAC. We think they're well positioned for it. And I think I better stop there so I stay on time. Thank you.
Thank you so much, Robin. This is such an important issue for the ADA centers, and it's been a difficult path filled with many obstacles to have an impact on this. So now I'd like to transition to Lindsay Brown from the University of Illinois at Champaign-Urbana. And Lindsay is going to talk about the available and quality of access to transit services. So Lindsay?
Hi, thank you for being here and thank you for having me. My name is Lindsay Braun. I'm an assistant professor of urban and regional planning at the University of Illinois at Urbana-Champaign. I am a white female. I have long blonde hair that's pulled up into a bun. I'm in my early 30s until tomorrow, when I guess I enter my mid 30s, and I'm wearing a dark gray shirt. Today, I'm here to give a talk entitled Bus Stops and Beyond, Connecting Riders to Transit Service in the Chicago Suburbs. And this talk is based on an applied research project that I conducted along with two of my colleagues who are listed on this slide, Bumsu Lee and Jesus Barajas. Next slide. This research is motivated by the importance of pedestrian access to transit. Pedestrian infrastructure elements such as sidewalks and crosswalks are critical for connecting people to transit service, and thus they're critical to the efficiency, effectiveness, and equity with which transit providers can provide service. And this contributes to overall patterns of mobility in our communities. Now, transit agencies do have ADA standards that they need to comply with, but most of these focus on accessible vehicles and accessible stops and stations. From the transit agency's perspective, there's less emphasis on changes to the broader pedestrian network. And this is a really critical gap because the majority of people who ride transit arrive and or depart as pedestrians. And so the infrastructure beyond just the bus stop is really important for their accessibility. But building pedestrian infrastructure is a challenge, not exclusively, but especially in suburban areas for a number of reasons. Some of the barriers are physical in nature, related to the fact that we tended in the US to design our communities mainly with the automobile in mind. And this creates environments that are difficult to retrofit for walking. The images on this slide show the contrast between a bus stop in an urban area right in the heart of downtown Chicago on the left, which has great multimodal infrastructure. But then the photo on the right is a view from a bus stop in a suburban location along a very wide, high-speed road in an environment where low-density development means that destinations are just very far from one another, and overall it's a difficult place to walk and to accommodate pedestrians safely. And there are also a number of institutional barriers. We'll get into funding issues here in a little bit, but one key institutional barrier from the transit agency's perspective is that as much as they might like to change the pedestrian infrastructure networks in the communities they serve, they're limited in doing so because that's not where their authority lies. They have the authority to change infrastructure at and maybe right adjacent to their stops and stations, but the authority to make changes to that broader community pedestrian network tends to lie with municipalities. Next slide, please. So our goal was to examine these and other challenges in the Chicago suburbs, which are served by PACE Suburban Bus, which I'll call PACE from here on out. PACE serves a very large and diverse service area. The map on this slide shows the PACE service area. Chicago proper is just a small portion of this map, but PACE stretches out wide to cover 6 counties and a whopping 284 municipalities. So remember, those are the municipalities that tend to have authority over changing the pedestrian infrastructure. So as one agency, PACE has to try to coordinate with all of those, which is a daunting challenge. And they've been trying to do this because PACE recognizes the importance of pedestrian access to transit. And they've been doing a lot recently to try to encourage it, even developing a set of transit supportive design guidelines that they hope communities will consult as they build their transportation network. But these and other efforts have had limited success on the ground. And so PACE wanted to partner with us to understand what are the barriers to building pedestrian infrastructure near suburban transit services, and how can these barriers be overcome? Next slide. With these questions in mind, we designed a project approach that had several main objectives. They're listed in the table on this slide alongside the methods that we used for each one. First, given the sheer number of municipalities in the PACE service area, we wanted to get a handle on existing conditions, existing plans, policies, and funding sources that support pedestrian access to transit. And we did this by reviewing documents and conducting a survey with planners in the region. Second, we wanted to understand physical barriers to pedestrian access, which we did by interviewing PACE riders and conducting on-the-ground field audits in several communities. Third, we wanted to understand barriers to project implementation, so kind of getting at some of those more institutional barriers. And we did this through stakeholder interviews with PACE, with regional and municipal planners and engineers, and with advocates in the region. And then finally, we wanted to gain inspiration by examining the practices of other suburban transit agencies. And we did this through surveys and case studies with similar types of transit agencies in 10 regions across the US. And we pulled all of this together to develop a set of policy recommendations for PACE and other stakeholders in the region for building pedestrian infrastructure near transit. And rather than give you a comprehensive look at all of the findings of this large and multi-year project, I want to, in the next several slides, pull out some of the main findings that I think are particularly relevant from the ADA perspective. Next slide, please. So the first set of slides will be about physical barriers to pedestrian access to transit. And I've divided this up into sidewalks, crossings, and the bus stops themselves. And these are all barriers that we're very familiar with. But sidewalks in the region tend to be to have gaps in the connectivity of the sidewalk network. Oftentimes sidewalks are missing. They often end abruptly. And in some cases, communities found it to be a measure of success if they had sidewalks on just one side of the road, but that doesn't provide, accessible and connected mobility. When sidewalks were provided, they often were in poor condition or faced obstructions. And those are illustrated in the image on this slide, which shows a PACE bus stop that does have sidewalks around it, but those sidewalks appear to be in pretty poor condition, and they're blocked by an important amenity, a fire hydrant, but that shouldn't be in the sidewalk. And so that's an obstacle to accessibility. This image also shows the frequent problem of pedestrians being inadequately separated from motor vehicle traffic. Often sidewalks are just a thin strip of pavement with no buffer protecting pedestrians from cars. One of our interviewees, a PACE rider, said there are no sidewalks to walk across, or the street that they're on are always busy. So it's hard to get to the stop. Some of them are not accessible to people with disabilities. Next slide. Crossings in the region often were unlabeled or had worn out markings. The image on this slide is of a crosswalk near a suburban bus stop. And if you look closely, you can just see the faded remnants of what used to be a marked crosswalk. And so often the infrastructure is in poor repair. The sidewalks leading to crosswalks often have missing curb ramps and curb cuts, or they have steep curb ramps. They often lack detectable warning materials that help activate the crossing signal. One of our interviewees said, the bus stop by my house, there's only one side of the street that you can walk across on safely through a crosswalk, and the other side doesn't have a crosswalk where the bus stop is. You have to walk all the way around, which could be, for someone with a disability, a little bit more difficult. And I would argue that it's actually a lot more difficult, and it's a symptom of having the authority to place pedestrian infrastructure and the authority to build bus stops be in different and often uncoordinated hands. Next slide, please. The final physical barriers are with the bus stops themselves. Bus stops often lack shelters and seating. This is shown in the image on the bottom left, where somebody's waiting at a PACE bus stop without any place to rest or to be protected from the elements. They often had limited lighting and signage, which creates challenges for safety, visibility, and navigation. And then bus stops had a host of other ADA accessibility issues. And the one that I think is the most dramatic is shown in the image on the right side of the screen, where we have a bus stop that does have a sidewalk, it does have a shelter, but it's only accessible by stairs. And what's maybe even worse is this bus stop is right outside of a medical center. So one of our interviewees said, we need somewhere we can sit down comfortably and wait there for the bus. You know how sometimes you have to sit there and stand? And I mean, there's older people that can't stand. I'm a senior citizen. I know how that feels. Next slide. Now turning to some of the implementation barriers. As I hinted at earlier, and as many of my co-panelists have brought up, funding is a critical barrier to ADA compliance and more broadly to building pedestrian infrastructure. In the US, even though we have a growing awareness of the importance of pedestrian infrastructure, funding tends to still remain limited and uncertain and unsteady, especially compared to what we spend on modes such as the automobile. Even if communities have funds to build pedestrian infrastructure, they're often prohibited from doing so because of high costs of ongoing maintenance. So that's a barrier to even getting the infrastructure built in the first place. Many communities have difficulty funding ADA improvements in their pedestrian infrastructure that are required because pedestrian funding is so limited. There are often jurisdictional issues that get in the way. And at intersections where state and local roads meet, both parties often kind of yield responsibility. And what's interesting is that one of our interviewees, who is just a pace rider, not a decision maker in the community, noticed this. And they said, they pawn it off on the state because it's Route 31. And then they pawn it off on the city, but the sidewalks are crumbling and they're tilting. And it's sad because we have older people here. The director encourages people not to go on those sidewalks. So when we have cases of kind of fuzzy boundaries and jurisdictions, it's the people who need to use the infrastructure that end up feeling the consequences. Next slide. And then two large implementation barriers specifically about ADA. There's often, as we all know, a lack of ADA compliance. And we saw this in our interviews throughout our project activities. And this was illustrated in a recent report where the sidewalk ends, the cover of which is shown on the screen here. And that report found that only 11% of municipalities in the Chicago region have current ADA transition plans. And among those that do, there's a lot of variation in plan quality. Fewer than half of the plans provide public input opportunities, and fewer than half outline a schedule for removing environmental barriers. But beyond compliance, we also found what we might call a lack of ADA centrality or emphasis. We spoke with advocates who had success in getting accessible infrastructure installed or upgraded, but the only way they could have that success was by being what they call the squeaky wheel. Accessibility, they described as an uphill battle that they had to repeat over and over again with every new project and every community, rather than there being a baseline expectation that infrastructure will be accessible. And this is due in part to limited awareness among decision makers, but not exclusively. Next slide. So just pulling out a few of our recommendations. On the planning side, we recommend that PACE document existing conditions at its stops and conduct equity and accessibility analyses so that stops can be prioritized based on their needs. And more broadly, we recommend that they develop an access to transit plan in coordination with their riders and the communities they serve. On the policy side, we had some recommendations around building capacity for ADA compliance and emphasis or centrality. So providing guidance, technical assistance, and funding for ADA compliance, and for attempts to shift the approach to ADA from one of regulatory compliance to routine and meaningful integration of ADA considerations across projects and throughout the planning process. And then we also had recommendations to encourage communities to complete ADA audits and transition plans. Next slide. For bus stops, we recommend that PACE implement a better bus stop program that helps them prioritize their improvements to the infrastructure at and around bus stops, but ensuring at a minimum that their stops are ADA accessible, and to provide, to review their process for reporting issues at stops, which riders often were unclear about. And then these aren't directly related to ADA, but we also recommend that stakeholders build and maintain a list of funding sources, create a platform for communities to share knowledge with one another, develop training and awareness campaigns for community members and staff members to understand the importance of accessibility and pedestrian infrastructure, and to revise prioritization and funding formulas so that our growing awareness that pedestrian infrastructure is important can translate down into day-to-day decisions about what gets funded and built. Next slide. So we just finished the full report. It's now available as of last month on the website linked here, and we're now in the process of doing outreach to decision makers and advocates at the state, regional, and local levels. And I'm happy to answer questions as we get into the Q&A period.
Thank you so much. That was great, Lindsay. So now we're ready to move into the question and answer period, and I'll turn it over to Kim. We'll have 20 minutes.
All right, thank you, Kurt. Right now I've got a few questions. It looks like I'll have one for each of the presenters. We'll begin with Robin. We recently had an emergency disaster in Texas, and many people with access and functional needs died in the ice storms and blackouts. What are your thoughts on the effectiveness of emergency assistance registries? Do you think they give a false sense of hope and preparedness to people and governments?
That's a very hot question right now. It's a great question. There are some people that absolutely think they're fabulous, and other people that say they quickly go out of date, they're not kept intact. People might not be where they say they might be. Clearly, there needs to be a way to identify people who are in absolute need. That's why we lost people during Hurricane Sandy, people who could not get out of their homes, and their family members could not reach them because of flooding, and nobody knew where they were, and they couldn't access anything, and those people died. It was completely preventable. And here again, I think in Texas, the same thing. So there needs to be a way in real time to let the emergency managers, or in this case, it would be first responders, search and rescue, urban search and rescue, let them know where people are so they can get in there, get you out in the best way possible. But yeah, I think that is certainly preventable. Thank you.
All right, thank you, Robin. Our next question is from Matthew. Do you think there is a correlation for municipalities' compliance if local advocates filed complaints?
Well, I mean, one of the things with this study was we were getting compliance from the viewpoint of the municipalities, a representative from the municipalities. I think that if you were to survey members of the community, they might have a very different picture of what their municipalities' compliance levels are, and I think in a less optimistic way. So I think there's also a thing of what we see in terms of correlations that's observable in the data, and what we kind of say, yes, I think we've seen across the number of these studies that, the squeaky wheel definitely gets people moving. And so advocates, there's definitely a correlation with advocacy.
Thank you, Matthew. Our next question is for Rich. How receptive were the jurisdictions when you presented the results of the research to them? Were they concerned?
The responses we have gotten, we've only presented it back to the state of Missouri, cities, through the League of Cities, not to the Association of Counties yet. And we're in the process right now of setting up additional dates to present that. What we have found, you're asking me about, concern. What we have found is the concern is coming from the League of Cities and the Associations of Counties themselves as representatives of all of these 3,000 plus jurisdictions, that they recognize the importance of this for serving persons with disabilities, for, I say, risk management issues for their clients or for their membership, put it that way. And so I think those are a couple of driving factors there. And yes, we're getting a response from those associations and leagues, but not feedback directly from the cities yet. We haven't, or the county governments themselves yet. But I will say, in the narratives and in the qualitative answers that we got throughout this mixed method process, yes, a lot of them indicated that they are concerned. They're concerned about political support. They're concerned about financial and resources, as all of my colleagues here have brought up, for community development. And so we were getting a lot of answers in the narratives themselves that indicate concern and indicate strengthening some very targeted issues for us in our region.
Thank you very much, Rich. Our next question is for Yohai. Did you find any municipalities that provided significant detail about the role of people with disabilities in their plans? How might meaningful disability inclusion change the planning process or impact compliance?
Yeah, great question. Thank you. We definitely did find plans and communities that did a lot with trying to establish meaningful public involvement. And, you know, one of the lessons I think that they shared is, you know, this need for planners to go outside of the local government, to not hold a meeting in the local government office, but to go to where people with disabilities are, and to get their input and to seek it, to listen to it. And that there was this need to reach out to multiple disability organizations, you know, the disability community. There's lots of different types of organizations, right, that represent different groups within the disability community. And so the ones that we saw really do a nice job are those that reached out to those broader organizations, and then that kept them involved, you know, throughout the process. It was both like a kickoff and an involvement, and then, you know, reaching back out as they had these important milestones in the planning process of identifying barriers or prioritizing barriers. But this is a tricky and important area, and you know, in our future research, this is definitely something that we want to focus on, and we plan to conduct research with commissions and coalitions of people with disabilities who have this role of being involved with communities, so we can also learn from them about what does successful disability involvement and engagement mean, how does it work, and how can more communities do this better? Thanks for the question.
Thank you, Yohai. Our next question is for Lindsay. Is there any compliance guidelines for having a transition plan?
Thank you for the question. So I'm not an expert in this particular area, but have learned a lot recently. And in terms of our specific research, we know that some communities, based on their size and characteristics, are required to complete the plans. And then it's our understanding that others, particularly smaller communities, are not. And so our recommendations were kind of two-tiered to make sure that the communities who are required to have them come into compliance and complete the transition plans. And there were several stakeholders, not really PACE, but some of our regional planning agencies that we think can be involved in that process. And then even for the communities that aren't legally required to complete them, to encourage them to do so and to conduct audits. And then for both of those tiers, our an overarching recommendation is that as they conduct the audits associated with the transition plans, that they prioritize audits near areas that are served by transit and near areas of high bus use. And because we obviously can't audit every every single part of the community in prioritizing locations that, we might focus on that integration with transit.
Thank you, Lindsay.
Thank you.
Our next question is back to Yohai. Here's a statement that comes before the question. I find a significant lack of awareness about the readily achievable barrier removal requirements among property owners. How can we improve awareness about this to effectuate greater accessibility in buildings constructed prior to the passage of the ADA?
Yeah, no, great question. And I think, it might be relevant. I'm thinking this question is more related to private property owners and to perhaps the infrastructure, pedestrian infrastructure around those buildings. And I think, part of that comes from the local governments, right, in educating those property owners about, specifically like the sidewalks that might be abutting those buildings. And then, for the building themselves, I think awareness can also come from the local government as well as disability advocacy organizations. The Great Lakes ADA Center used to have this great little card that could be given out to property owners. If anybody, a person with disability, anybody who can kind of identify some of the barriers that are there, could leave this card for that business or property owner and identify, here's some access issues that I see, and here's some resources for how to change those. So those are just some of the ideas that I could think about right now. But what we saw in some of the communities that I think was successful is, again, that, like I talked about, that organizational change around disability. I think that what we saw was that organizational change also led to community change in awareness about disability. And that happened through various public events and different ways that, that the community got out there and, talked about this, let people know about it, had it involved in different kinds of events to raise that awareness. Thanks.
Thank you. We go back to Matthew for this next question. Who are the actual respondents for the jurisdictions to your survey? Were they, for example, ADA coordinators or a legal department, or maybe city managers?
Yes, so it started off with a list of largely of ADA coordinators, but were basically the contacts which the ADA Center already had with municipalities. And then for those municipalities which we didn't have a contact already, we contacted the office or looked through their website to try to identify who might be the most likely person in the office who could answer questions about disability policies and procedures for the municipality.
Thank you. I hope that answers your question. For this next question, we go back to Robin. There's a statement beforehand. There are coordinated efforts across municipal, state, and national community emergency response teams. How might one leverage this to implement training into the courses and training that CERT members must take?
So I think the question is, how might you leverage the training that's already going on, ongoing training for CERT team members, NERT team members? Is that the question?
Yes, I believe so, yes.
Okay. Well, obviously they have multiple trainings. And by the way, somebody did ask me about FEMA trainings for disabilities, and there is a very good FEMA training. Some of my students have taken it and I've taken it, and it's quite good. It's under training.fema.org, and it's IS 368. It's the training for people with disabilities to ensure that you're compliant. But it's hard for me to picture. An ADA coordinator has so many different roles. They're doing way too many things. And for them to attend, let's say it's once or twice a month, a training that's being given by the local OEM, which is probably how it would happen, or the local DOH, to have them attend that training, which would be great and help them meet some of their community members for sure. But it's hard for me to picture that they'd have that availability. And most of those kinds of trainings, of course, are held at night. I think Louis Krause is on this, this Q&A. And if somebody could open his mic, I think Louis can speak to this very much more definitively than myself. Louis?
Yeah, thanks, Robin. I just wanted to add, I think that a lot of these questions about training have to do with what kinds of training the people were telling us that they wanted. And I don't think that it's necessarily that the ADA coordinators were looking at Fema training or that kind of training specifically. They were trying to understand how ADA connects with emergency management. And so that's the kind of training that they were looking for, which is a very different kind of training than maybe sometimes what the FEMA and other emergency management trainings were making available. So that's the fundamental point here, is that you've got these ADA coordinators who have all this responsibility, many things going on, as Robin said, and yet they have this responsibility, or maybe they have this responsibility, or they're juggling the responsibility with the emergency managers, and nobody's got the responsibility for dealing with the disability issues that happen in planning and in preparing and in during an emergency or even after. So that's the gap that's happening there, and the training is something that would be, I believe, something new and different than what exists now.
Well, thank you both, Louis and Robin. Looks like we have one last question right now. We may have time for a few more, but I'm not sure. This next question is for Rich. Is this a common problem where commissions on disability are reluctant to push issues in the face of residents and elected officials who don't want to follow the ADA law?
Could you repeat that question, please?
Of course I can. I will start at the top. Is this a common problem where commissions on disability are reluctant to push issues in the face of residents and elected officials who don't want to follow ADA law?
Well, I'm not sure what commissions the questioner might be, to which they might be referring. We have seen a great deal of cooperation across our region between our independent living centers and our CILs, with whom we work closely on this issue. As self-evaluations and transition plans continue to be generated, one of the recommendations we see often is some kind of an advisory commission, ad hoc or whatever it might be, that is disability focused, using members from the CIL or the community who have disabilities. We've seen a lot of progress in that particular issue, but we also do see, some smaller communities, especially those remote rural ones, where there's a lack of understanding amongst the elected officials about what's required of them, where you'll hear comments about, well, our courthouse doesn't need to be accessible because we don't have anybody with disabilities using it. And so we have both ends of a spectrum, if you will, on that particular topic. I would like to add one thing to the last question, if I could, please. There is, the International Code Council has in their website and within their programs, education for building officials and people involved in enforcement of the building codes for emergency preparedness. And that's boots on the ground kind of stuff. I mean, where, after an emergency, code officials come together at the community and they coordinate tearing down, turning off utilities, turning on utilities, rebuilding. They coordinate and flag buildings step by step and have specific provisions for persons with disabilities and for application for persons with disabilities within their own training programs. So I think that's a worthwhile thing, and it speaks to, again, to our alliance with the Code Council.
All right, thank you, Rich, for the last addition. Those are all the questions that we have. I'm going to turn it over to Kurt, who has a few quick words before we begin our break.
Thank you all for asking questions, and thank you all for answering questions. We're going to move to a 15-minute break now. When we return, we'll have our final speaker, who is Victor Pineda. So please have a break, and we'll see you back in 15 minutes. Welcome back. Well, now we'll hear from Victor Pineda, who is the president of World Enabled. And Victor will reflect on what we've heard this morning and try and bring that together. So Victor, I'll pass it to you.
Thank you so much. Again, what an honor to be with so many colleagues really thinking about, how do we meet the moment? Where do we find ourselves? Not only 50 years, 50 some years after the ABA and 30 years after the ADA, but where do we find ourselves in terms of building back better? Where do we find ourselves in terms of reimagining what we can accomplish to build a more accessible and inclusive cities? My background so for the folks that can't see right now, I am a 42-year-old Latinx man with brown hair, brown eyes, light colored skin. I am have a big smile on my face, but I'm also bringing to you an attempt to synthesize our discussion from various vantage points. I am a two-time presidential appointee to the U.S. Federal Access Board. I've served now under 3 administrations, and was one of the greatest honors that I had was helping to negotiate and implement the UN Convention on the Rights of Persons with Disabilities. That international treaty really took a lot of our values and principles around building barrier-free environments and elevated it to a set of principles, ideas, and promises that allowed cities around the world to emulate what we've done, or at least to attempt to create laws, policies, procedures, programs, training, research that gets us closer to a world without barriers. Now, what we heard today is a series of very important interventions, and those build off of conversations that we heard yesterday. Whether it was, understanding on yesterday employment and economic self-sufficiency with my good friend Maria Town, and thinking through the way that, John talked about AUCD, to think about how we might be able to really create new opportunities. We need to be able to understand what is happening on the ground. Where are the patterns of exclusion? Where are some of those access, the axes for inequality, meaning where are the dimensions in which we can make visible that which is too often invisible. And by that I mean is, how do we actually see those barriers and respond to those barriers? Now, what we heard from Matthew earlier from the New England ADA Center is understanding that the surveys that can deploy insights that we can gain from those surveys can get us a little bit closer to an active condition on the ground. But the question that remains is, how do we see bigger patterns in various dimensions? How do we help create tools, resources, actionable intelligence that local governments can integrate into their capital resourcing and budgeting? And how do they look at building in sustainable solutions to their accessibility initiatives? I think the Great Plains ADA Center, Richard, gave us again really great insights on that. The questions that were made for me is, cities will be facing tremendous budgetary pressures. Part of the work that I've done beyond the Access Board and the global work is I helped draft the Dubai disability strategy, and I also teach a class in the Department of City Regional Planning at the University of California, Berkeley, on building the inclusive city. One of the primary vectors or vehicles or dimensions for understanding and operationalizing access and inclusion, making the ADA real, is through the budgetary process. And the budgetary process is something that has to incorporate, real costs and deferred costs. Kenyo Chai did a great job synthesizing the strengths and limitations of ADA transition plans on pedestrian infrastructure, but helping us remember that, there are, lawsuits, and there is the lack of productivity and the ubiquity of the ability to access the public realm, primarily through sidewalks. And those barriers, how do they limit, our effective recovery, and how do they limit, making it pleasurable or making it feasible for people, not to be so car dependent. The question becomes, what are the other costs relative to the environment, relative to financial exclusion, our employment rates, by having not only the lawsuits, but also cities that make a big chunk of people, whether it's, there's recent estimates that 25% of people in cities experience barriers on the basis of age or disability. And there were some great conversations in the chat box around really linking together age and disability, really linking in together a way of designing age-friendly cities and accessible and barrier-free cities. Also with the Pacific ADA Center, Robin talked about the ADA coordinator's role, and specifically how much pressures are put on the ADA coordinators. How diverse that experience is, something that's mandated by federal law and then trickles its way through hundreds of, if not thousands, of agencies across the US. Still has, a million ways of being interpreted, and even more so, a million different pressures now with the rise of jurisdictional emergency management. Her perspective on Region 9 is really telling not only of the lack of institutional and coordinating capacity, it really highlights a key finding of my research globally, which is that the biggest barrier to inclusive and accessible cities and the biggest challenge on the local level isn't just better laws or better policies, isn't just leadership and budgets, but rather it's the administrative and coordinating capacity of the local agencies that carry on a multi-dimensional transformation of that city both from the hardware and the software. What I mean by hardware is the built infrastructure, the roads, the roads, the public spaces, the transportation networks. But also beyond that is to understand that there's a software. There's a software to a city. And that incorporates the issues of culture, that incorporates the issues of history and its own trajectory, its own struggles on racial equality, the visibility of the disability rights movement, the demographics of the aging communities. So all of those, create, the conditions by which the hardware and the software ultimately needs to be negotiated, it needs to be defined, needs to be mobilized and resourced. So inclusive and accessible cities, require us to look at those various dimensions and to qualify those dimensions. I can share with you my approach, and I'll ask some of our colleagues that are here to maybe share a link to my book, which is available as open access by Belgrave. It's an academic book called Building the Inclusive City. I have a copy right here behind me. It's that orange book right underneath that mirror. But it really presents a holistic, rapid assessment for our research community and for the ADA centers to think about multiple dimensions. Obviously, in research, we want to have tight research protocols, and we want to have a targeted research question. But we also want to be able to understand the dimensions by which our research, for example, in the built environment, relates to research on accessible transportation, relates to research on digital transformation, relates to the co-benefits of accessibility and net carbon zero, or net zero carbon future, an environmental transformation of our built environment and of our cities. So I think for me, what this opportunity presents us is the opportunity to have new kinds of partnerships. And I really want to commend Pimjai and all the colleagues at Neidler, all the colleagues at the ADA Knowledge Translation Center to really focus on the local governments. I want to throw out some statistics just to give you guys a bigger framing. The world is urbanizing so rapidly that we're building urban areas of 2 million people every week. That's 100 million people are moving into cities every year, which is just a tremendous burden on cities all over the world, not just in the US. How we build those cities, how we build the capacity of those cities to be at the forefront of all the global transformations as they have been during this pandemic will really call upon us to leverage technologies such as artificial intelligence, such as equitable approaches to autonomous vehicles, as my friend Sachin started off today's conference on. How to look at blockchain as a way for all people, including people with disabilities, to make a secure and private disclosure of their preferences when interacting with digital infrastructure that is in our cities. or whether they're using an app that allows them to use public services. I also serve on the Center for the Fourth Industrial Revolution, which is a research center here, the Presidio, very much working with the World Economic Forum. And as part of my research there as a fellow at the Center for the Fourth Industrial Revolution, I'm thinking a lot about how is the deployment of IoT, Internet of Things technologies, how is that being done in an equitable way? How are we ensuring that the future we build is the future we want? And, in my work with the UN in negotiating the UN Convention on the Rights of Persons with Disabilities, as well as the Sustainable Development Goals, SDG 11 is the SDG that we were able to get very clear targets for the world, that we will not build cities that leave people with disabilities behind. But all of those are just promises and aspirations, unless we have the data, unless we see, what those challenges look like, unless we understand how to respond to those challenges at scale, both in a nuanced way and in a way that allows us to really understand various dimensions of exclusion, but also a way that allows us to really elevate the priorities on that local place. But we need a framework. So I think my book, I'm going to present to you my framework as sort of my parting gift in summarizing things for our discussion today. But I did want to definitely give a shout out to Lindsay and her team on the bus stops and beyond. Obviously, as I mentioned, we cannot think about public spaces without the linkages between those public spaces and the transit services. Thinking about micromobility as well, beyond the bus stops, right? And other kinds of mobility solutions that are coming online. And so just to give you guys that framework in a way that can be really helpful to you, and when you think through this, obviously you can dive in deeper in my book, but it's got 5 interrelated pillars. And these pillars really are about the ways we can dive deeper into research. And these pillars include obviously understanding what the local municipal ordinances are and how closely they connect to the national, state, and national, federal, international statutes. The second pillar, and that's legal analysis. Second pillar really looks at what I call leadership. And I define leadership as having both a rhetoric around access and inclusion by the mayor, by the municipal leader, by the city council, as well as linking that leadership to adequate budgets. The third I mentioned briefly is this idea around the institutional capacity. That's really where cities and local governments constantly need support, which is the administrative, the coordinating capabilities. In the city of New York, it's like 56 agencies within the municipal government, the local government. So how do they coordinate those access challenges? How do all those ADA coordinators embedded within all those other agencies actually work together as a coordinated team? And how do they do that in smaller settings where they feel very much alone? The other, and how do they coordinate that with civil society, with research organizations, or with the private sector to leverage good solutions? The fourth area of analysis is salience, which is really attitudes, beliefs. And we're noticing that even though we've made a lot of progress, and there is a cultural sort of awakening around that people with disabilities are here to stay, and that we have a legacy and a culture around civil rights and civil liberties and protections, legal protections. There still might be embedded ableist notions that we need to be able to understand in order to really elevate and amplify the legal or the institutional or the rhetorical approaches to equity and access in cities. And the final pillar, which again I highlighted in my book, and I want to encourage everybody to download because it is open access. We have, and it's available to download each chapter, is the issue of participation. And we've heard a lot of rallying cries around participation, but I don't believe in participation unless it's substantive participation. And what I mean by that is that there has to be a way to give people choices, to have them evaluate those choices, to have them act upon those choices, and to have them realize the result of those choices. And that really is about expanding human agency. So if you are having a participatory process, it's not just about having a consultation. It's about having a process for empowerment and to unlock human agency for a community, for a network, and for individuals that can continue to elevate their own leadership. And that substantive participation also has to be representative. So if you don't have, white males that use wheelchairs, and you think that you've identified the needs of the disability community, you've got a lot of challenges that you're going to encounter in terms of really understanding the dimensions and the breadth and the diversity. Because that experience, again, elevating the visibility of older persons, elevating the unique needs of LGBT, undocumented, BIPOC communities in the multiple levels of institutional exclusion, institutionalized ableism, institutionalized racism that exists. But there is hope for us. And that hope is specifically by continuing to really look towards the future. What I mean by that is that we can't just complain about the past, but actually get a head start in building the future. And by that, I mean really doubling down on the kinds of research that is emerging around autonomous vehicles and micromobility, around artificial intelligence in public services, and facial recognition and machine vision. And I'm going to leave my email address below for everybody, all the panelists and attendees, to feel free to reach out. If there was something that you thought was really powerful about my contributions, I'm happy to sort of set up a one-on-one to dive deeper with anyone. And this is my Calendly link. So if you want to set up like a little virtual coffee, I'm happy to sort of explore that with folks. My big goal right now is dedicated over the next 10 years to incentivizing and transforming 100 cities to be more inclusive, accessible, and resilient. And we're doing that through the Cities for All Global Compact and campaign. The website just went down today because we were hacked. But hopefully in a day or two, we should have it all up. We just started piloting a series of learning modules, which will also provide on platforms like Coursera and Teachable to really help elevate, training tools. But we really would need to work together. So if you have developed training tools for local governments, if you have developed resources and guidelines, please share it with me so that we can put it on a global information clearinghouse, the Cities for All competent campaign, and really share the knowledge, because the US is ahead of the curve and a lot of cities want to do more. They just don't know how. I'm sorry about noise in the background. My grandson is 1 year old and he's visiting. And my 86-year-old grandmother is here. So we have 5 generations of people sharing a little quarantine bubble. And that's why you might be hearing some background noise. But in conclusion, we each have an opportunity to look at, our capabilities and eliminate the capability deprivations that other people are encountering. I think if we start to reimagine disability as a capability deprivation instead of just a medical abnormality, we'll see that cities have a lot to share in terms of unlocking our capabilities, in terms of respecting our lifestyles, and in terms of helping us all feel like we belong. Because ultimately, in a city that we belong is a city that we care about, is a city that we invest in. It's a city that also invests in us. And that is the fundamental nature of the social contract. Even though we're in this great reset post-pandemic, and we're going to be facing major challenges with an upcoming recession and climate change, the work that you do at the local levels is really what's going to determine the quality of life for people. Their day-to-day lives, the way they go to the grocery store, the way that they go to the movies or eat at a restaurant, the ways they get to work. But that knowledge and that process and that transformation isn't just limited in the US. It's happening in thousands and hundreds of thousands of cities around the world. So I want to invite you all to join me, learn more about our work. Obviously, the website for Cities for All will be up again soon. And I really look forward to a strong partnership with the ADA Knowledge Translation Center, with NIDLR, and for the regional groups as well, so that we can really leverage on today and shape a better tomorrow. Thank you all so much for your time and for your contributions today. I'll leave it at that.
Thank you so much, Victor. We really appreciate that. It was thoughtful and gave us lots to think about. And thank you all for attending today. We really appreciate it. Tomorrow we'll be back again with a focus on access and inclusion, with a keynote speaker and 5 research presentations. And then we'll have a summary as well. When you leave today, you'll get...
Sorry, Kurt, I interrupt you. Just wanted to make sure that if anybody had any questions, I'm happy to answer them either in the Q&A or in the chat. And you feel free to just sort of introduce yourselves. I'm happy to sort of engage in the chat. Thank you, Kurt.
So, Victor, I think the problem with that is that we're going to shut this down in a second. So perhaps you've given them their email. Could they address questions to you by email?
Oh, sure, of course. That's great.
Okay. And we'll put that out once again in the chat window. So tomorrow, when you leave the webinar today, another window will open, which is has the feedback form, and we'd really appreciate you responding to that survey and giving us feedback. Stay connected with us on Facebook, Twitter, LinkedIn, and we'll talk to you tomorrow. Thank you.